Hi all. Once again a warm welcome to my YouTube channel Future Midwife. Today's our topic is premature rupture of membrane. The premature rupture of membrane refers to the rupture of fetal membrane or amniotic sac before the onset of true labor contraction regardless of gestational age. If it occurs before 37 weeks of gestation, we called it as preterm premature rupture of membrane. Whereas if it occurs after 37 weeks of gestation or before the onset of true labor, we called it as term premature rupture of membrane. Here I will explain about the pathophysiology of premature rupture of membrane. As you all know, the amniotic sac protect and surround the growing fetus. Inside there is a amniotic fluid. This amniotic fluid is essential for the development of growing fetus. It acts as a cushion to the growing fetus as well as it helps for the thermoregulation and lung development. The rupture of membrane spontaneously occurs due to the weakening of the membrane or due to internal or external factors which lead to loss of protective barrier, risk of ascending infection, polyhydramnia and stimulation of true labor pain. So these are the pathophysiology of premature rupture of membrane. Here I will explain about the etiology or causes of premature rupture of membrane. It can be categorized into two ways, maternal factors and fetal or uterine factors. So we will see the maternal factors. The maternal factors include infection, smoking, poor nutrition, short cervical length and prior PROM or preterm birth. Whereas in case of fetal or uterine factors which include polyhydramnios, multiple gestation, fetal anomalies, trauma or invasive procedures such as amniocentesis and intrauterine inflammation. So these are the etiology of premature rupture of membrane. Here I will explain the signs and symptoms of premature rupture of membrane. The main sign and symptom include a sudden gush of amniotic fluid from the uterus, wetness in the underwear without urge to urinate. Initially, mother never feel any abdominal pain or contraction. There will not be any vaginal bleeding unless abruption is suspected. So these are the main signs and symptoms of premature rupture of membrane. Here we reach the diagnostic evaluation of premature rupture of membrane. In that first one is history collection. In that we will ask the mother about the time and amount of fluid loss, color and smell of fluid and any uterine contraction, bleeding or pain occurs during this time. Next one is physical examination. In that we can perform sterile speculum examination. With the help of speculum we can identify a pooling of fluid in vaginal fornix. It is very important avoid digital exam unless in labor or delivery is imminent to reduce the infection. Next we'll move on to the diagnostic test. In that first one is nitrazine test. This nitrazine test is used to detect the pH of amniotic fluid. Usually the pH of amniotic fluid is alkaline in nature. So here the nitrazine strip turn the color to blue, so which indicate the presence of amniotic fluid. Next test is Fawn test. The Fawn test is a diagnostic tool used to detect premature rupture of membrane in pregnant women. Here a sample of vaginal fluid is collected from the patient. The fluid is then placed on a microscope slide. The slide is allowed to dry completely. Once it dry, the slide is examined under a microscope. There will be two results, positive and negative result. In case of positive result, if the fluid contain amniotic fluid, it will form a fan-like pattern under the microscope. This indicates that the membrane have ruptured. In case of negative result, if the fluid does not form a fan-like pattern, it suggests that the membrane is intact. Next, we can perform ultrasound, which helps to measure the amniotic fluid index and check fetal well-being. The last test is AmniSure test. The AmniSure test is a rapid non-invasive diagnostic test used to detect premature rupture of membrane. Here, a sample of vaginal fluid is collected from the patient using a swab. The swab is then inserted into the amniocentesis test device. The device detects the presence of placental alpha microglobulin 1, a protein which is found in amniotic fluid. Here also we have positive and negative result. In case of positive result, a alpha microglobulin 1 is detected. The test indicates that the membrane have ruptured. In case of negative result, alpha microglobulin 1 will be absent. So which indicate the membrane is intact. So these are the diagnostic tests which we can perform in case of premature rupture of membrane. Here we reach the last section of our topic, that is management of premature rupture of membrane. The management can be categorized according to the gestational age. So first we will see the management in case of gestational age more than 37 weeks of gestation. The first one is observation. So if there is any sign of premature rupture of membrane occurs after 37 weeks of gestation, first we have to observe. If no contraction, monitor for 12 to 24 hours. Then we can go for induction of labor. Start oxytocin in order to induce the labor. Next one is antibiotic. Usually we never start any antibiotic if there is no sign of infection. But in some hospital, according to their protocol, they may start the antibiotic in order to prevent the infection as a precaution. Usually we will wait up to 6 to 18 hours. If there is no sign of labor contraction, we can start antibiotics. In case of delivery, it should be recommended within 24 hours to prevent any kind of infection. So these are the management in case of more than 37 weeks. So next we will see the management below 37 weeks of gestation. So depending upon the gestational week, we can decide the management. If it is between 34 to 36 weeks, consider delivery due to increased infection risk. If it is less than 34 weeks, we have to go for conservative management. So which include hospitalization and monitor the baby and mother, corticosteroids for lung maturity. For that, betamethasone 12 mg IM 2 dose has to be received. Next is antibiotics. So mother can get antibiotic like ampicillin plus erythromycin to prolong the latency. Tocolytics also can be administered for the short term, which delay the labor for steroid. Next, we have to monitor for any sign of infection such as fever, uterine tenderness, fetal tachycardia, etc. So these are the management can be performed if it is less than 37 weeks of gestation. Here we can wind up our today's section. I hope all of you understood about premature rupture of membrane. In this video, I explained about the definition of premature rupture of membrane, etiology, clinical features, diagnostic evaluation and management. The complication and nursing intervention will be displayed on the slide. Please have a look on it. So in the next class, we will meet with another episode of midwifery topic. Till that, take care. Bye-bye.